Lifeline, an alternative to hysterectomy. Why aren't more women being told about it? Up next, Lifeline, a less invasive procedure to treat a common woman's health problem. Why aren't more doctors letting patients know about it?
From ABC News, this is Good Morning America with Charles Gibson and Diane Sawyer, live from Times Square.
And we also have important health alert for women about hysterectomies and an effective alternative that could help avoid major surgery.
Of the 600,000 hysterectomies done for various reasons on American women every year, as many as 75% may be unnecessary, say some experts.
This is Wolf Blitzer Reports for Thursday, November 18th, 2004.
The woman President Bush has picked to be the next Secretary of State is scheduled to have surgery tomorrow. A spokesman says National Security Advisor Condoleezza Rice will be treated for uterine fibroids. Here to explain what that is and what the treatment entails is Dr. John Lipman. He's an interventional radiologist at Piedmont Hospital in Atlanta. Dr. Lipman, thanks for joining us.
Uterine fibroids are benign tumors. It's the most common pelvic tumor, and it's present in 1 of every 3 women of childbearing age, and even more common in African American women. Well, I don't know the specifics of Dr. Rice's condition, but typically the most common symptoms of patients that have symptomatic uterine fibroids are very heavy bleeding. They can also be very painful. They can cause urinary frequency, painful intercourse, a number of symptoms, but it's typically the very heavy bleeding that is the most significant symptom. Our procedure is called uterine fibroid embolization, and it's performed by an interventional radiologist who are physicians that are specialized in these minimally invasive targeted treatments for a whole host of number of medical conditions, but in this case, uterine fibroids.
It was multiple symptoms, bleeding beyond control, pain beyond control. During the day, I had to wing it with 2 or 3 pads, plus an overnight, the super tampon, and literally have stood up out of my chair at my desk and had blood run down my legs.
Yeah. For women suffering with uterine fibroids, it's really important to know that they have options. In the past, a patient might go to their gynecologist suffering with the symptoms of uterine fibroids, namely heavy bleeding, pelvic pain, increased urinary frequency, and we're told either to have a hysterectomy if they were not interested in having children, or a myomectomy, surgically removing the fibroid tumors and sewing the uterus back together if they were interested in fertility. And those were the only options available. Fortunately now, we have uterine fibroid embolization. It's a procedure that's completely non-surgical. Patients will come into our facility in the morning and leave that same day. So it's done as an outpatient. The patients have no general anesthesia. The anesthesia is local and IV sedation. They leave the same day with a bandaid. So there's no surgical incision, no cutting on you. The recovery period is obviously much shorter. Instead of the 6 to 8 weeks for surgery, it's 4 or 5 days for fibroid embolization. So it's a very safe, very effective, less invasive procedure that will treat the symptoms from fibroids very effectively. A woman can avoid surgery altogether and keep her uterus.
Hysterectomy is not an option. I know that most of the women in my family, that were my parents' generation, have had hysterectomies, and that's not an option for me. There's got to be a better way.
My father is the one who prompted me to actually seek this treatment now, because the fibroids had gotten to the point where I went to 3 different gynecologists, and they all said the same thing to me: you need to take it out, just take out the uterus. To be honest with you, after hearing it enough times, you start to believe, you know what, maybe I just need to take it out, because they keep telling me it's just no good. There's nothing else they can do. Just take it out. But then when you read about it and the effects of having your uterus removed and the advanced start of menopause and things of that nature, it was like, I don't think I want to do that. Dr. Lipman brought it home for me. He made it real. There's a treatment. You don't have to take out your uterus. You can save your uterus, and this will help. And it did.
Dr. Lipman reads the results with you sitting there looking at the results together. He didn't sell me on anything. He wasn't matter of fact, and he wasn't comparing this procedure to that procedure. He told me, you're a candidate for this procedure. It wasn't a matter of, you can do this or you can do a hysterectomy or anything like that. It was, you're a candidate. And I went in there with a list, probably 20, 25 questions concerning, what are some of the side effects? If this happens, does this happen? Can it do this? All those different questions I wanted to be armed with. So I did my research ahead of time so that when I sat down with them, I could get answers to that. And just a very human doctor, very accessible doctor. You know, sometimes doctors can be a little cold and aloof, and he wasn't anything like that, you know, and I felt very comfortable, especially after doing my research. Dr. Lippman can actually go through all of the ins and outs of the procedure and things more than but I didn't experience any of that because I asked what are some of the side effects and symptoms.
I don't have relief. I am free, okay? And I'm going to say that again, I am free.
During my cycles, I started noticing that I would have really large clots, big clots of blood that would come at times, and they were so large that sometimes I could feel them moving.
My worst problem was just such a heavy menstrual flow. I was probably on my period 2.5 weeks a month.
I had this period that just would not stop. For 21 days, I had my period, which, you know, at that point, you're like, something's really wrong. And, you know, psychologically, when you have your cycle for that long, you're just not the same woman.
I was at a jazz concert in Greenville with my fiance, and we were standing in a huge crowd of people, and you know, I was very diligent when I was on my period, but I had been out there for about 10 minutes, and we were sitting on a rock wall, and suddenly I just went, oh my gosh, and I was surrounded by people, and I told my fiance, I said, I think I just bled all over my skirt.
The periods were just outrageous. I mean, if you have to wear 2 pads at a time, your period's out of control. You know, if you have to sit on newspaper because you're always soiling your clothes, it's out of control.
My gynecologist told me that I had what was called a fibroid, and at the time I didn't know what that was, I didn't know what it meant, but he told me that I needed to get it removed.
She said, well, your choices are a myomectomy or a hysterectomy. And I said, those are my 2 choices. She explained both procedures to me, would put me out 6 weeks, and I was not happy about it, but I went, well, might as well go ahead. Well, I went home, and about a week later, I went ahead and scheduled my surgery. And the whole time I kept on going online thinking, I can't believe that I'm going to have hysterectomy on the same year I'm getting married, and I'm going to have to hurry up and have it done because I want to be okay by my wedding in October. I'd asked my OBGYN several times. Actually, I talked to her on the phone 3 times and talked to her in the office. Is there any other option for me? And she said, no. She said, it's a hysterectomy or myomectomy. I'm like, no other option.
So I went online and started doing research. I actually talked to a coworker at work who mentioned to me that she had had the procedure with Dr. Lippman several years before. And she said she was one of the first of his patients when she had it, and she was very pleased with it, didn't have any problems. So I looked for him. I Googled his name. I found the institute and started reading. I started looking at other research on UFE and fibroids, and I pretty much decided at that time it was something I wanted to do.
2 weeks before my scheduled surgery, I found Dr. Lippman's website, and I read all about it. It seemed amazing, almost too good to be true to me. But I went ahead and made an appointment, and I came on down and had my MRI, and Dr. Lippman saw me immediately after my MRI, same day. I had a fibroid. For some reason, he uses fruits to describe them. I had a grapefruit, one the size of a grapefruit, 2 the size of oranges, and I think I had like a couple of apples in there. And I couldn't believe all that was inside of me, and I was carrying that around, and it made so much sense as to what all my different symptoms, what had caused all that now. I said, I want to have this. He said, you're a candidate. I said, I want to have it. And I had it it was a Thursday, I believe, and I had it that following Monday.
After finding out, the size of the fibroids and what we could do, I was just tickled. I said, let's schedule it right away, because I'm one of those people that wants to get it done. And I had my UFE in December of 2005. And I have not had any trouble since.
I went in January of 2007, and I had the procedure. Within a week, I was back to work. I felt great. I couldn't believe I felt that great. I remember thinking, something must be wrong because I feel too good.
My life has changed too, because I can't even believe that I have not one symptom, nothing. My period is about 2 days a month, and it's regularly scheduled, and it's just too good to be true.
It gave me a renewed sense of life that I do have this opportunity, and even at 42, it was better than just giving up and having a hysterectomy, which I knew I was never going to do. So now I feel like I'm 11 months free, I guess.
If you're suffering with fibroids like I was, make an appointment with the fibroid expert, Dr. John Lippman. He gave me freedom from fibroids without surgery. You'll get your life back.